What's a topic that comes up a lot? Getting enough sleep. In just a few minutes, Dr. Kohli weighs in if sleep aids are good or bad to use.
Well, Dr. Kohli, it's great to have you back.
Thank you, Danny.
Yes,
great to be here.
Of course. Okay, so we've been talking for the last few months, and every time we talk, I feel like the one thing that keeps coming up is how important sleep is and just how vital it is for us, longevity, our bodies. But sometimes we just can't get the sleep that we feel like we need. So a lot of us turn to different sleep aids, things that we can take. Do you as a doctor recommend sleep aids to your patients? What do you think when it comes to taking medication?
This is a tough one, Danny. There's very specific circumstances under which I will prescribe sleep aids or recommend over-the-counter sleep aids to my patients.
Yes.
But for the large part, sleep aids are not something that I'm a huge fan of. And that's because they can be habit-forming.
Sure.
They can have a hangover effect.
Yes.
So oftentimes you get the sleep, but the quality of the sleep, or the architecture, as we like to call it, of the type of sleep that you're getting is actually worse. Almost like alcohol. When you drink it, you fall asleep more, but you're not getting sort of good quality sleep.
Yeah.
Certain sleep aids have actually been linked to cognitive problems and behaviors like sleepwalking and such. And certain sleep aids actually can have rebound insomnia. So when you stop them, you can have a worsening problem with sleep. So I'm not a huge fan of them in general, but there are certain circumstances in which I will recommend them.
Okay, let's talk about those. When are we okay to use those sleep aids?
So I would say, short term for the shortest duration and the shortest dose necessary. So for example, jet lag is a really good example.
Sure.
Right? If you're traveling abroad somewhere, you need to sort of reset your sleep-wake cycle.
Yes.
I'm a huge fan of sleep aids.
Yeah.
If you're someone who works at night or you're switching back and forth and you need to kind of switch your schedule back and forth on a quick basis,
Sure.
I think that's a really good idea.
Okay.
Some occasional insomnia, which we all suffer from.
Yes.
Here and there you have, you can't sleep some night. You can take it once in a while. It's really not a problem. Okay. And then of course, if you've been through any kind of stress, whether it's the loss of a partner or financial loss, and that's interfering with your sleep, then short term using it for a few weeks might make sense in order to restore sleep. If you have chronic insomnia, that's where it's a little trickier.
Okay.
Because some people with chronic insomnia really do need the sleep aid to get some sleep because sleep is very restorative, but you don't want to necessarily use the wrong one. So those are situations in which I'd talk to your doctor for sure.
Okay, amazing. Now, I'm a big fan of this next one here, more natural remedies, things that we can do to make sure that we're, staying within our sleep schedule or our circadian rhythm. What do you think when it comes to natural remedies here?
So sleep hygiene, we've talked about. I mean, that's really important, making sure you're, going to bed and waking up at the same time, avoiding screen time within a couple of hours, those types of things. But melatonin, I think, is a pretty good natural remedy. And that's because melatonin is a substance that our brain actually makes, that pineal gland. So you know how we're regulated by light and dark with our sleep. So this is a sleep-inducing hormone that our brain makes. The only kind of caution I'll give with that is that it's not regulated by the FDA. So you want to be really careful about the dose of melatonin you're getting. Because different preparations can have different doses, and sometimes the doses are even off from what they say on the label. And I wouldn't use it in kids. We've been seeing a lot of parents using melatonin in kids for flights and such. I would be really careful to talk to a pediatrician about that. But melatonin I'm a fan of, especially for jet lag or, if you're working at nights and such, to kind of help you restore your sleep back. I also really like magnesium.
Yes.
So magnesium at bedtime. Magnesium is involved in making melatonin. It's involved in relaxing our muscles. It helps with anxiety. It kind of helps us fall asleep, and it's really good for the heart as well. So that's another sleep aid that I sort of recommend. It can soften your stools a little bit, so if you have trouble with chronic constipation, it can also keep you regular.
Interesting. I have been taking a lot of magnesium since we are expecting. That has been one of the daily regimented vitamins I've been taking. But one of the other ones that I've been taking is a medication that is safe for pregnancy that is used in terms of sleeping and for sleep aid. And I have to say, for me, it didn't help me sleep, but it did give me that little bit of a hangover. What do you say for pregnancy and for people that are maybe postpartum even too when it comes to sleep aids?
We have to be really careful. When you're pregnant, you're obviously, everything that you take goes to the baby.
Right.
And similarly, when you're breastfeeding or lactating, the same kind of transmission can happen. So many of these sleep aids have not been studied in pregnant women or lactating women. So I really like the old-fashioned techniques, the cognitive behavioral therapy, the sleep hygiene, the magnesium's a great choice. Massage around bedtime is a really nice way to sort of induce some of those hormones. Deep breathing and meditation also releases hormones from the brain that help us to relax. Imagery has also been shown, visual imagery, closing your eyes and picturing, certain things to release those kind of sleep hormones. So I really am a fan of that in pregnant women. If it's getting to the point where it's completely interfering with your sleep, you're just not getting any sleep, then I would talk to your obstetrician about some sleep aids. But in general, we don't know the effects on the baby. We also think the effects may vary according to what trimester you take it in.
Sure.
Because obviously the baby's highest risk during the first trimester, third trimester, less so.
Right.
So it's really a personalized conversation to have there.
Okay.
And I'm sorry you're struggling with sleep. Have you tried any of the other ones
You
that
know,
I suggested?
a lot of the other ones have actually been working a lot better now. Yes, that one, yeah, not going back to that guy. But Dr. Kohli, thank you so much.
And make sure to email us your questions for Dr. Kohli. Just send your message to mycoco@9news.com and put Kohli in that subject line.